This is Dr. Scott MacLean, and this is a presentation about implant dentistry. Today we'll be talking about the On1 tissue level abutment from Nobel Biocare. During this presentation we'll be using a guided surgery approach to place a NobelActive implant and then follow that up with a On1 abutment, which you can see on the right here. Now once the implants have osseointegrated, then the prosthetic doctor can take off the healing cap, or they can even take off the whole abutment and go back to the implant level. So they can choose to go implant level or tissue level based on their prosthetic needs, prosthetic space, the angulation of the implant, the depth. So it's all very flexible, and this prosthetic flexibility is fantastic. Of course, having the On1 concept gets you to tissue level and gets that abutment in place at the time of surgery, allowing for that abutment to stay for the patient's life. And furthermore, it gets us to the level where we could have bridge work with maintaining platform shifting and concepts of keeping the bacteria out of the sulcus and out of the bone. And so this is just a really great area to be opening up. Now, having a platform that's at tissue level is not a new concept. In fact, there are many implants that are designed that the solid implant is placed at this level. However, what is kind of new at this concept is that you're able to place the implant to bone level, then to add a platform. So you add the platform, therefore if you needed to take it away in the future, you could. So situation where maybe you lost some soft tissue, or maybe you had an implant in the wrong position, you can then take it back out and have prosthetic versatility. So let's get started here. We can see we're going to place the 2mm surgical template in and make sure that that fits down, and we'll use a 2mm twist drill which has a +10 length. So the +10 length allows us to know where we are when we're going up by the sinus area, so we can get the proper depth and angulation for this implant. The long 2mm drill is going to give us both depth and angulation. When we place this drill into the guide, we can see as it goes into the template, it will enable us to kind of tell how deep the osteotomy is going to be, where the sinus is. We are going to tap the sinus up on this case a little bit, which will be a very easy procedure, so we can push the bottom of the sinus up, bringing the cnidaria membrane up, and just place the implant in and let the bone kind of fill in around this implant. So we're going to use the flapless approach here. This case does have adequate keratinized tissue with good soft tissue thickness. So we looked at this on Nobel Clinician. You can see it with Smart Fusion. You can actually see the thickness of the case prior to beginning, which enables us to make that decision. So we'll take the 6mm disc, which is going to guide the punch, and we'll put this in position and then come back over with the tissue punch to get the exact disc of tissue that we want out of here. Now it's a very precise type of flap, so it does heal very quickly and with very little inflammation, because we're not kind of lifting up the other tissue off the bone. So if I do have enough tissue, I can choose to do this. If I didn't have a lot of tissue, I'd bring the tissue from the lingual, bring it out to the facial, and kind of beef it up that way. So I'll take a molt and kind of elevate that little disc of tissue off of the bone, and this is the extent of our flap and entry into the patient, which is minimizing the wound to the patient. So the patient feels relatively very little at this point, maybe a little tiny bit of pressure, but not a lot. So we can see the disc is taken off, and we will actually just hold on to it just in case we have to suture it back in place if we're going to cover the flap back over, but we do put it on a piece of sterile gauze and keep it around. We're going to take a Brandemark pilot drill, which has a 2mm non-cutting kind of core. This core will go into the first 2mm drill and kind of make it about a 2.4, maybe even a 2.8 osteotomy. This starts to line things up. We do have to think about the angulation of this implant, because we don't want to have drill drift, because we can get that. So often I want to make sure that the back of the drill is kind of in position. So we're looking at this from different angles, and if you've done a lot of implants, it's relatively straightforward on a lot of cases, but we do have to be careful, and guided implant surgery is certainly probably doing 9 out of 10 cases with fully guided now. Once in a while we'll do this and use the 2mm to kind of take us to the right position, and then kind of follow up with keeping the angulation in the same position as we go. You can see I'm holding the mirror to kind of watch my side view and also my axial view at the same time. We're actually using the drill as a sensory probe at this point, measuring the density of the bone and kind of measuring how tall the bone is to the sinus, so we can kind of use that to kind of, just like you would do in bathtub water to test the water, we're testing the bone, and then we can decide when we're going to jump in to try to elevate the sinus. This bone is a little tiny bit lighter, and so we're going to tap this up with a mallet, and we have this sinus elevator tool so that they can just kind of push up on the base of the sinus and lift up the Schneiderian membrane, so we can kind of stay inside of that. And this is just if you want to do like a 3 to 4mm bump. You can put bone in there if you'd like. We chose not to do bone on this case. However, sometimes I do. It just depends on how good the quality of the bone is. And so as I go back in here, usually I'm seeing bone fill around the base of the implant, even if I don't place some extra bone in there. So it's about getting that Schneiderian membrane up so that we're not directly inside of the sinus, because whatever's on the inside of that Schneiderian membrane is going to form into some bone, and this is what the body's going to do. So we can see here we're gradually making the osteotomy a little bit bigger, but we're not going a lot deeper. So we want the entrance of this implant is 4mm on the tip, so we do want to get the tip inside, and then we'll let the implant kind of condense the bone as it's going in. You do have to have a little bit of experience when you're doing this. This is something that you kind of feel over time, but this Noble Active implant is amazing. So this is a 5.5 by 8.5mm implant, and it's going to deliver the goods here. We can see it's got a generous thread on both sides, so 2 threads. As it goes up, it's a variable pitch design, which has a tionite surface, which is great for bone apposition. It helps to make the bone grow, and we can see that as we put this implant in, it really grabs. So we can put this in more than one time. So as we go in, we do want to make sure that we're paying attention to our angulation. So one of the things I try to do is to put the implant in position, then line it up so it's going to hit the buccal cusp on the lower, because we know that's the functional cusp on this occlusal scheme. So by lining the implant up in this position, keeping it in the center, having that first drill piloted, we can get this implant in a really very excellent position, which is needed for these tissue level implant abutments, because we have to be in a screw retain position. In my mind, I'd rather be anyway. I'm getting away from cement. 99% cement's free, so here I want to get the implant in position a little bit deeper than what we're showing here, and then I want to get it below the tissue so that we're going to have the adequate kind of soft tissue seal that we need for these implants. So I want to be about 2.5, 3mm here, so my prosthetic space on the case is going to be 10mm. So I know that by using guided surgery that I can get this implant into that position, so when I do the final restoration, this is going to be in an excellent position. We're just checking the torque so we can go back a little bit and then go forward. Get this torque to 70 newtons, which is the ideal manufacturer recommended torque on this implant, which is about double the torque of most implants, which is quite amazing in an area of the mouth that is known to be a little bit more challenging to get the torque. This is easy usually to get torque of 70 with a 5.5mm implant. Plus, we're increasing the surface area of the implant by having a wider implant. So we're going to create a nice emergence. We can also put this implant at a good depth so that we can get great emergence profile coming up from this implant. Now, I do like to use the On1 1.75mm abutment. It makes sense to me to have using that prosthetic space very sparingly. So then I'm going to also place on a 2.5 millimeter healing cap on top of that, so for healing. So now that the implant's in position, we're going to start to suction that off, and we'll start to tighten down and make sure that this implant is in the right torque. So you can see here, this is going to torque at about 70 newtons right there. So this driver is a specially designed driver for the Noble Active because it's double the torque of most implant systems, which is why we need to have this extra wrench. So this is a very strong wrench. You can see that the torque, we have to get to the second line here. So that torque level of 70, when we go to put an abutment on at less than that, the abutment's going to be able to be fully torqued and not even come close to what the torque is needed on the case. So we're going to tighten the On1 abutment to 35 Newton centimeters. Now I'm proud to say this is a kit that I sent to design into Nobel Biocare, and they actually came through and made this kit. So they modified a bone mill, so I suggested that we kind of flare this out. So they did make this flared CC bone mill. What it's used for is to cut the bone out, because often when you place the Noble Active or a CC implant, you're going to have bone stay because of the lack of the inflammation around the top of the implant. So this bone mill is flared, so it's just slightly bigger than the abutment that you're going to put on. So it enables soft tissue to come down around the top of the abutment. So we'll put on a bone mill guide, and this one's a blue one, which means it's a wide platform guide. So it will enable for the bone mill to come down over top and cut exactly over top of the implant, so not scratching the implant. But this is really, really important to do when you're placing a conical connection implant, because often there's bone in the way, and we don't want that to be in the way when we go to seat the abutment. So when we go on, we can put the bone mill on it. It's going to flare the area just above the implant. So we want that flare to be just slightly bigger than the On1 abutment, so when we go to put the On1 abutment in, it's in position for hopefully for the rest of the patient's life. Because that's what we want to do here. We want the implant to be in the ideal spot so we can get this to be screw retained. Then I'm going to try to place a 1.75 millimeter On1 tissue level abutment. So I'm going to be partway through the tissue, but this is going to put the platform shift and seal the implant at the time of surgery, so that we're not going back down to the implant on this case. So right here, the platform shift, which is shown in red, is going to be sealed. And we can see the soft tissues right up here. So this shows us that the soft tissue is going to be kind of sealing this area off. So we can see the platform shift in red, and then the level of the implant impression here. So this can be digitally picked up. It can also be picked up with closed tray or open tray impression copings. When we go to the mouth, there's a carrier that takes this to put it into position. This is not a typical screw-in type of healing abutment. There's a hex on this with a conical connection, so as it goes in, it seats in a position that's going to be indexed. The carrier makes it easy to take the abutment into the implant interface, and it's this little plastic handle that helps you to twist and get the abutment seated. And this is seated at the time of surgery, which gives you a platform shift plus a tissue level platform, which is two features that I really like, because we're getting emergence, we're getting the platform shift, and this is done at the time of surgery, which is key to this concept. And that is the concept, is to seal it at the time of surgery. Now, if the implant does get in the wrong spot, or if we start to have a little bit of tissue loss, there's versatility in this system. You can take off the On1 abutment, go back down to the bone level, and you're going to gain a little bit of space here. So it gives us the ability to deal with tissue loss if we had to, or with aesthetic issues. And in particular, if we want that versatility, it's nice to be able to take this off if we wanted to. So I think that is a very powerful part of this concept, is we can get tissue level, but we can still go back down to bone level, which has been proven with the platform shift to maintain bone. So this is a long-term type of solution for the patient, and it can be very versatile over the length of their life. So we can see here it's just below the tissue level, which is going to give me the space that I need. I want prosthetic space. So I'm going to place an On1 healing cap, which is 2.5 millimeters high, which lets the tissue kind of heal around this cuff of this healing cap. And so once the healing cap is taken off, we can do impressions with impression copings, closed tray, open tray, or we can use iOS scan bodies to scan this case, and these are all ready to go right now. So this is how this concept is going to work. So I like to use the 1.75 millimeter On1 abutment with a 2.5 millimeter healing cap, which gets me above the tissue, allows me to be in a good position for really picking this impression up, and then we can get an ideal result. So we get a final torque of 70 Newton centimeters and minimal bone in the maxilla, which is just exceptional. The On1 abutment is going to be just below tissue level and provide the seal at the time of surgery. So this is Dr. Scott MacLean, and this has been a YouTube presentation about implant dentistry.